This station is designed to test a candidate's ability to control hemorrhage and manage shock. This is a scenario-based evaluation. There are no assisting rescuers for this station. Candidates have 10 minutes to complete the station.
EMS providers respond to many calls involving hemorrhage and shock. Knowing the basic steps of bleeding control and how to manage shock can definitely help save a life. Do not waste valuable time on the scene starting IVs when this can be done in an ambulance en route to a receiving facility. Remember that time is the enemy when it comes to severe blood loss.
Candidates at this station will have the equipment necessary to successfully control bleeding and manage shock. The patient will be moulaged using items such as fake blood with prosthetic devices to depict the desired injuries. Equipment and supplies for assessing the patient can include a trauma kit with dressings and bandages to control bleeding. A blanket and supplemental oxygen are available for managing shock, as well as medical exam gloves as part of the necessary personal protective equipment. There are two main sections of this station: bleeding control and shock management.
Welcome to the bleeding control and shock management station. You've had a chance to check your equipment. Do you have any questions?
No.
Okay. You respond to a female patient with a severe laceration on her arm. The scene is safe and the patient is conscious. The airway is open and she is breathing.
Okay, I'm going to take body substance isolation precautions. Grab the arm and apply direct pressure and elevate the arm.
The wound continues to bleed.
I'm going to grab a second gauze bandage and reinforce.
The wound still continues to bleed.
At this point, I will apply pressure to a pressure point.
The bleeding is controlled.
Okay, at this point, I am going to bandage the wound.
The patient is exhibiting signs and symptoms of hypoperfusion.
I will position the patient for shock. Okay, at this point, I'm going to lay the patient down. Please hold your arm. I'm going to elevate the patient's legs. Cover her with a blanket. Apply high flow oxygen. At this point, we need to prepare the patient for immediate transport, and I will start an IV en route if necessary.
Is there anything else you'd like to do?
No, I've completed the station.
Thank you.
Begin the station by indicating that the proper personal protective equipment is being used. Apply direct pressure and elevate the extremity. If bleeding is not controlled, apply additional dressings and pressure to an arterial pressure point. With the bleeding controlled, bandage the wound to maintain pressure. With the wound bandaged, care for shock by positioning the patient. Apply a high concentration of oxygen. Prevent heat loss and indicate the need for immediate transport. The examiner checks the candidate's performance against the critical criteria for the station. The critical criteria for this station that would have resulted in failure were failing to take or verbalize the use of body substance isolation precautions, failing to provide a high concentration of oxygen, applying a tourniquet before attempting other basic methods of bleeding control, failing to control the bleeding, and failing to indicate the need for immediate transport.
A key to this station is to remember the basics of bleeding control: direct pressure, elevation, pressure bandage, and pressure points. Manage shock with patient positioning, maintaining normal body temperature, and supplemental oxygen.